My name is Mandi Killian. I am a care patient coordinator for Bulverde Family Medicine. I think the biggest thing that I have seen in the industry as far as communication is being able to keep good communications between families and facilities. If there's a change of care, or if there's change of insurance even, there is a breakdown within the industry there for sure. And that's one thing that I'm super happy about with Hucu, because I can add any family member or any facility in, and I can, contact them directly instead of waiting on hold, trying to get a hold of somebody or not getting an answer through an email. Then I can call directly to them or send them a direct message and get a quicker response. Yeah, so I think the biggest problem is just, especially if there's a transfer of care, following up with the patients and things like that, the ball gets dropped. And being able to reach out to the families to get information and stuff, I think families get to a certain point where they've heard so many different outcomes or so many different care plans that they get tired of hearing the same thing and seeing the family member, seeing the family member's health decrease to where they're put on, a hospice program, or they have to go into the hospital multiple times instead of having the communications directly with the doctors or the nursing facilities themselves. More efficient. It's made my job more efficient. I'm, connected with the facilities. I'm connected with each patient. It helps me keep track of our census better. If the patient goes out into the hospital, the patient comes back. If the patient fell, if there's been a change of medication, I can, one of us can flag it, and I can go on there, I can see that flag, and I can update accordingly, depending on what the issue is. I think it's huge. I mean, it really has changed our outlook. I would love to see, all kinds of things with Hucu. There's so much potential for Hucu. I'm so excited. I mean, I even have my own little dreams about it. So we'll see what happens. But yeah, it's a game changer in the industry as a whole. Something I've never seen before. I can tell you that the one family member that I was able to get into Hucu, she was super excited about it. She really liked the fact that, if she had a question or a concern, that she would be able just to text it right to me, as if she was just sending a regular message. I think once we start onboarding the facilities, I think some of the nurses they're going to be ecstatic. I think even like the medical records department, or even, the admins for insurance verifications or billing, I think it's going to be a great tool, because if there's update on insurance, then they can just snap that card and send it right to us instead of having to fax it or put it, and then we have to dig through all their records, and so I think it's going to be more of a streamlined process between not just us but the other facilities, and once we get there, even into the hospitals, because anytime a patient goes into the hospital, we have to get those records immediately. We can't just wait around all willy-nilly. It's like the first thing, as soon as I know that they're back, it's like, okay, I'm calling 3 or 4 different people, making sure that we're getting those records in a timely manner. So I can see in the near future that's going to alleviate a lot of it, because then you can just download it, and then if it's connected with our system, our EMR system, it's there. All we have to do is download it and make sure it goes into the correct chart. Oh man, super simple system. the administrators at Hucu, they've been so open to the ideas and stuff that we've had. They've already actually implemented some of the ideas that we wanted to see integrated within Hucu. If you can use a text message, or Zoom even, you can use Hucu. I mean, I think my son, my kiddo, I think he could get on there and look at it and be like, oh, this patient, needs blah, blah, blah. He would even be able to know how to use it. It's super simple. Putting the patients in are super simple. Updating them, super simple. If we need to discharge them, super simple. It's a straightforward system. And it's just so intuitive. It has saved me time. So because we do run a live spreadsheet, if a patient goes to the hospital or is returning from the hospital, all I have to do is, click my little notification, look at it, and then I can immediately in turn, go to my spreadsheet, update it, and boom. Versus before we had Hucu and we were using another system, trying to find it, and then it wasn't working with, that. I mean, it was a mess, and it would, take 2 or 3 hours out of my day just because, trying to research and, understand what really happened during the night. Versus now, if I wake up in the morning and there's, 4 or 5 notifications, either I can jot them down, or I can send me a little screenshot note to myself going, okay, this patient's discharged, need update chart, versus taking the time and calling the facility. And, I mean, it's cut it in half, probably it's cut it down 75%. It's been a huge impact on my job. It has also helped give me more of a voice within the company. Just different ideas and understanding different processes, or being able to make processes based off of Hucu and implementing them into our current processes. And peace of mind knowing that, as everybody, if I don't see it, somebody else is going to see it, and the ball isn't going to get dropped. That's huge, because if I'm out or I'm sick, or, one of the girls, is out, for personal reasons, they also have that peace of mind, like, hey, somebody else other than just me is going to see this. Once Sarah and Kayla, decide that the babies are coming, then they will also be able to go back and look and see, okay, this is, here's the timeline, even with this patient, because it's all there, that's the biggest thing right now is the medical record part of it, because it's, trying to get some information, simple information from a facility can take days instead of just going, hey, can you blah, 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 and then they send it right over through the app. It's amazing. It's the greatest app ever for this industry. It's a game changer.